Now, what about that? What about gaps? Do you think, realistically, looking at maybe other people's situations as well as yours, are there gaps out there that you've seen?
There are gaps. I pointed out that there was, in fact, 2 people I knew have died and they didn't get any support. I had to sort of tell them, look, you're entitled to this, and tell them what to do through their own GP and the hospital and that.
And given your extensive experience, not just with yourself but your family members,
Yeah.
can you think of a way how things could be organised a little bit more effectively for people with cancer?
The only way I think it would be effective is they made sure that this care was offered to them. Very important.
So they make almost an offer to everyone.
Yes.
To check whether people are in need of help.
That's right, yes. I mean, it could be a busy time, but what's a busy time to a life? You know?
I guess that's a good point, that sometimes staff are very busy doing certain jobs.
Yeah.
They might overlook other areas which aren't their core area of responsibility. Obviously, from my point of view, I think of psychological and emotional issues.
Yeah.
But it could apply to other areas as well.
That's right. Yeah.
And we have to be careful, don't we, to avoid missing out on patients' needs, really.
Yeah, and another thing that whether this should be on, when one of my oncology doctors, I went for my scan and x-ray and had to see one of the oncology doctors. It wasn't till I was getting near the door that I found out she'd left. Now that did put me back. It was a bit upsetting, really.
I think I understand what you're saying. One of your clinicians
That's right.
had recently left the trust.
Yes.
And you saw one of the people that were filling in for her.
Yeah.
And then you were told almost at the last minute, well actually after the fact.
Got to the door.
After the fact, there's this key individual for you, the consultant had gone.
Yes.
And you weren't otherwise informed.
Yeah, but now I see another oncology doctor and he's quite nice. I feel safe
you've
and
got trust in him.
Yes.
And that's important because if you have trust in your clinician, you believe that they're going to find the right options for you.
Yeah. Yeah.
And you're more likely to follow their advice because you think, well, they'll give me their honest opinion.
Well, yes, although sometimes you don't want their honest opinion.
Actually, I was going to ask you about that.